What do we need to do to raise awareness of the issues linked with dealing with this material when working on buildings?
Well, there's a number of issues. First of all, we need to understand that these materials are used not only by homeowners, by DIY enthusiasts, but also by the industry. Both of those groups are very vulnerable for different reasons. First of all, homeowners, they have this insulation in their ceilings, in their roofs. These are the houses in which their children live. And as we know, the earlier the exposure to these fibres comes, the more dangerous for the long-term health. With people working in the trade, the building industry, it's different because they're working every day with these products in a raw form. So they are very, very vulnerable to inhalation. So to raise awareness, we need to, first of all, make homeowners aware of the dangers of having exposed mineral wool, exposed insulation, which we see a lot. We see it in schools. In the industry, the workers themselves actually need to understand what the health problems are and to use the appropriate safety clothing, for example, face masks, gloves, in the same way that people on building sites have to wear protective headgear, high visibility vests, boots. So they should be wearing those masks as a matter of course. In fact, it should be a requirement to work on a building site with these products. What we really need to do is to address all of the various issues: the inhalation, the danger to the eyes, to the skin. This needs to be done through labelling and through awareness. How can we deal with those all in one? There is actually a very simple answer. The product that you buy when you go to Wix or to Brico or wherever, the products that you're using as a builder on a construction site, this is not what was tested. This is not what was tested. Now, mineral wool was originally considered by the World Health Organization as a carcinogenic substance. It was then tested and downgraded. The EU still considers it to be a level 2 risk of cancer. Okay, this product now needs to be retested with the ingredient that was removed at the last test. That ingredient was the binder that holds the fibres together. That is the carcinogenic part of mineral wool, and that needs to go back in. Once that is retested and we can get the product either produced to a more safer standard, or we can recognise the dangers, then it's a simple matter of legislating in order to get all of those various issues surrounding the product addressed. What happens is this falls apart and it gets into the air very, very quickly, and it's the most dangerous version of mineral wool that you're at the most risk of inhaling. And that is also the generation of mineral wool that when you see in a school, you might see a damaged wall with some of this stuff sticking out. We've all noticed it. We just walk past it. We just assume it's a bit of repair work that needs to be done. Actually, it's a danger. It's not quite the same as having exposed wiring hanging out of the walls, but it's not far off.
Do you think the retailers are doing enough to let people know of these dangers, or is it really the responsibility of the producer to alert people to the need to wear masks and gloves?
The retailers very often, of course, are not experts on these products. So, you know, they may not know, the staff may not know about this. The industry itself does not want to draw attention to the dangers. So they are not going to voluntarily put big health warnings. If you think about tobacco, packets of cigarettes, this product can kill you, etc., can cause cancer, your smoking kills others, that kind of thing. They're not going to put that on their product unless they're actually forced to, and that's only going to come through legislation. This is the perfect time to start calling for this legislation again. Why? Because we now have a new European Parliament, we have a new Commission coming in, and this legislation has to be at EU level.